Welcome to another episode of Exercise Matters with me, Randall Cooper.
And me, Mick Hughes.
Support from today's podcast comes from Premax Performance Skincare. If you're active, you focus on strength, endurance and recovery. But what about your skin? Sweat, friction and the elements, they take a toll. That's where Premax comes in. High-performance skincare made for high-performance people. From recovery creams to anti-chafe balms, massage creams to exercise-specific barrier creams, we help your skin go the distance. Keep your skin as fit as your body with Premax. Available now at premax.co.
And support for today's episode also comes from Learn.Physio. Health professionals, are you staying ahead of the game? Learn.Physio brings you cutting-edge education from world-class experts in sports and musculoskeletal medicine. Online courses, hands-on practicals and expert resources backed by the latest evidence and designed to fit into your busy schedule. To be your best, learn from the best. Get started today at Learn.Physio. Oh, we nearly made it through, mate. I just had a little slip of the tongue, but 8 episodes in, we're getting smoother and smoother on these intros and outros.
You're doing very well, and editing, I think, might clear you up. So maybe people don't hear anything, and you sound beautiful.
Those
now we're going to talk
deep tones.
We're going to talk about what I find is a fascinating topic at the moment, and something that I think affects both our athlete population, the people who are into sport and exercise and want to keep fit, but also we've got some health professionals that listen into this podcast as well. So, Mick, how have you gone over the journey with weight? Is it something that you've had to kind of worry about? Do you really have to kind of keep on top of your diet and your exercise to make sure you stay at a healthy BMI?
Yeah. I'm a yo-yo. I feel my best when I'm sitting on about 85 kilos, and I'm currently sitting at about 90, 91 on a good day. Definitely the last few months I've been unable to exercise as much as what I like, so that's certainly seeing my weight sort of skip out of me. But I certainly feel my best when I'm 85. To stay at 85, I find it quite hard. I often have to sort of go really hard on my diet, and that's by far and away the thing that allows me to get my weight down to a really sort of happy place. So I'll mix and match between intermittent fasting through a few stages of the calendar year. But funnily enough, when I get to that sort of 85 kilo sweet spot, that's when the chockies start coming in at night time, and the extra little bags of chips and all those little things that make me also feel happy and joyful start getting laid on, and before I know it, I'm back out to 88, 90 kilos again. So I'm a bit of a yo-yoer, I must admit.
In researching this topic, I'll tell you about me in a sec, but in researching this topic, one of the terms that I came across, which I hadn't heard really before, was something that's called, particularly with this weight loss stuff, is what's called food noise. And that essentially is like where you've got an internal conversation going with yourself, for some people that is, not everyone, about food all day. It's like, what am I going to have for morning tea? Like, what's for breakfast? I haven't got anything planned for lunch. I'm going to get stressed about that. Is that something that affects you, or do you just kind of not worry about it all other than your chockies at night?
No, it doesn't. I don't crave food. I don't always think about it. I just get those, like when I'm hungry, like especially if I've been fasting and I haven't had a meal since dinner time and it's now midday, I'm thinking, I need to eat something, but I don't wake up thinking, what do I need to have for breakfast, or I'm not planning out my day. The only times it comes to food and planning is making sure we've got our Monday to Sunday dinners planned. We're a bit regimented like that. We sit down and do a meal plan, and we sort of do that as a family just to take away the daily cognitive loads. But yeah, I'm not that. I don't have food noise, so to speak.
Yeah, well, it's definitely something that I have.
That's an interesting term.
Yeah, no, when the term came across and someone described it, it's like, yeah, that's me. So, I mean, I'm someone who I would say that I've perpetually been probably between 4 and 6 kilos over my ideal weight for most of my life. Sometimes I have found that I've gone and got really quite lean. And for me, my kind of fighting weight, for a better expression, is about the same as yours, is about 85, 86 kilos. When I get down into the low 80s, I look great, but I find that I get a lot of colds and I just don't function all that well. But when I'm 2 or 3 kilos over, I feel like I'm really quite resilient, actually, like when it comes to kind of just coping with life. 85, 86 is kind of my go-to.
Yeah, that was my wedding day. I was 82. That was the lowest I've ever been as an adult. Even since like I was in year 10 or 11, I think I don't ever remember sort of being less than 80 kegs. And so, yeah, I felt, well, like you felt just that lack of energy. Like I looked bloody great. I, had abs for the first time in a long time and I felt lean, but gosh, I was definitely on the tireder side of things. But yeah,
Yeah.
yeah, that's that sweet spot. I think that extra bit of fat can give you a little bit of staying power.
But for some people, whether you're an athlete or whether you're not, like people can be a lot larger and have a lot of issues. And there's been an explosion of interest and awareness over what's called GLP-1 RAs over the last few years. So these are drugs that are typically people will know the name of now. Ozempic is one, Wegovy is another, and the newer one that's kind of come onto the scene is called Mounjaro. So what I'd like to do is I'd like to talk about those drugs today, not so much just purely from a weight loss perspective, but I want to talk about what they are and how they work, their implications for athletes and people who enjoy exercise, but also implications on musculoskeletal kind of conditions as well, including people who've got arthritis or sports injuries, that kind of thing. So hopefully this is kind of interest. So the first bit's really about just talking about what is a GLP-1 RA and how do they work. So GLP-1 stands for glucagon-like peptide 1. GLP-1 is a naturally occurring hormone produced in the L cells of your small intestine in response to eating. This kind of hormone was only discovered back in the 80s, and the drugs started to kind of come in the early 2000s. So its primary role is to help regulate blood sugar after meals. So it increases insulin secretion, it suppresses glucagon secretion as well. But probably the two most important things from a weight loss point of view is it slows gastric emptying, meaning that the food actually stays in your stomach longer, and it leads to slower absorption of nutrients and a feeling of fullness. And it also reduces appetite by acting on the brain's appetite centers, particularly up kind of like in your hypothalamus. So it's a satiety hormone essentially, and it also helps kind of regulate blood sugar. So with this critical role in glucose control and energy balance, this was a drug that was for these GLP-1, and Ozempic has only been around for the last 7 or 8 years, but the GLP-1 kind of agonists they really help like diabetes, type 2 diabetes, and their regulation of energy and sugar in their blood. And that's the population that use these GL1 RAs for many, many years. The interesting thing about the GLP-1s is that they're rapidly broken down. So the half-life of this hormone is only 1 to 2 minutes. So once you've eaten something, that will spike up GLP-1. It's only 1 or 2 minutes, and then an enzyme called DPP-4 comes along and basically neutralizes it out. But this is the really important thing is the pharmaceutical versions, which the active ingredient is called semaglutide, modified and resist this breakdown, and the GLP-1s stick around in your bloodstream for 7 days or longer. So, so that's basically kind of how they work.
And are people taking these, the diabetics, are they taking them daily? Is it a once a day tablet, twice a day? Is it a once a week tablet? What's the consumption?
It's a injection, and the injection is once per week. And for diabetics these drugs have been around now for about 20 years or so. In most Western countries, Australia included, if you're diabetic, this is on the PBS and this is supported by, like the government basically. But for weight loss, the drug is not supported by our pharmaceutical benefit scheme. So it costs about $460 a month to be on this. So it's like a $5,000 or $6,000 a year drug to kind of help with it. So, significant cost, which I think's like a burden for some people. But the interesting thing I've been reading is that a lot of people just say it's so important to my life that I'll just find the money.
Yeah, right. So currently covered for type 2 diabetics.
Mm-hmm. Yeah,
but not for weight loss, not for cosmetic use or athletic performance.
That's right. But the people in Hollywood who have been taking it, I don't think they really kind of care.
They
So,
probably don't
yeah,
care too much.
yeah. So Ozempic is the drug that is for the diabetics. And then Wegovy is exactly the same drug, semaglutide, that is for weight loss. So that's the same thing. The dosage is a little bit different. In the Ozempic population, there's a sliding scale or an ascending scale, I should say. You start off on a low dose of around about 0.25 a milligram, and then you go up to 2.4 or 2.5 over time. Whereas with the weight loss drug, the Wegovy, it's just 2.4, basically,
Right.
kind of from the outset. So they're
Yep.
the two GLP-1 receptor agonists. There is another drug that's on the scene that's called Mounjaro, and it's a once weekly injection like Ozempic and Wegovy as well. But this is a slightly different drug because it does have a GLP-1 receptor, which is the same as Ozempic and Wegovy, but it also has got another receptor that it binds to, and this is called gastric inhibitory polypeptide receptor. So big names, but
Mouthful.
basically this has got a dual mechanism, and what they've seen with this drug, and this has only been around for the last couple of years, is that this dual mechanism actually helps with even more weight loss compared to Ozempic and Wegovy. And that looks like it's kind of coming on the scene. It's so popular now that the manufacturers are out. And on their website, they say we
Wow.
cannot supply this drug again till August 2025. We're recording this, late April, early May. So
Jeez.
it's the scale of these drugs now is just off the chart.
Yep. And I can only assume that you have to go see a GP to get, if you were using it for weight loss. This isn't like vitamins or supplements that, or illegal steroids. You can just get on the dark web, or you can go onto the website and order these. You have to go through a GP to get these.
It's prescription, so you do need to go to a doctor to kind of go and get it in pretty much everywhere. But there is, and this is what we're going to talk about, with some of the studies that have been published on this, that there's a lot of off-label use. And
Right.
we've seen that, Oprah, for instance, was, saying that she kind of was on it. She used to be this big Weight Watchers advocate, but getting paid millions of dollars. But she went on to Ozempic and it just totally changed her life, and she dropped a lot of weight and she told everyone about it. So there's a lot of people who are doing it for aesthetic reasons. I have heard of people who struggle with their weight, who, whether they're just recreational athletes or even pros, saying I run like me, like 3 or 4 kilos kind of overweight. I find it really hard to shift. So I'm going to just take this injection once a week to bring me down to being really lean. So
Yep.
I think it's important we kind of talk about some of the benefits, but also some of the pitfalls with it as well.
I would imagine that there'd be athletes in particular, those that need to cut weight, would probably be a group of athletes that would see some appeal with this type of drug.
They definitely would. That's part of let's kind of tackle this topic now. So one of the things that it will do is that it's very effective at reducing weight. So going back to kind of like the key study was published in 2021. It was called the Step 1 trial, and it was published in the New England Journal of Medicine. And what they looked at was that it was a 68-week, double-blind, randomized, placebo-controlled trial involving nearly 2,000 participants. So it's a really
strong
high-quality, really good study. Participants received semaglutide. The people who got this drug lost on average 14.9% of their body weight compared to 2.4% of the placebo group. Interesting, the placebo group still lost weight, but 15% of your body weight is significant. Yeah.
Yep.
I mean, for me, that would get me down to, my fighting weight again, and you down to your wedding, down to where you were when you got married.
That's it, right? It's 100 kilo person is, down to 85 kilos over the course of how long?
It went for 68 weeks, but what I've heard is that like a lot of people will drop that weight, 1 to 2 kilos a week without even thinking about it. It's just, it becomes very easy. So the semaglutide group showed significant improvements in also cardiometabolic kind of risk factors as well, waist circumference, blood pressure, lipid levels and whatever. So it's got more than just kind of like weight per se. But going back to the athletes, clearly, like if you're in any kind of sport, and most sports are in this category, weight loss improves power to weight ratio and endurance capacity. So if you're a runner or a cyclist, or even a footballer, for instance, and you can get 3 or 4 kilos lighter, then you're just going to be aerobically better for it. And the other thing also is that the benefit is that, as we know, both you and I being physios, is that any joint related issues, particularly wear and tear kind of issues, a reduction in weight can reduce stress on the joints and potentially lower the risk of them getting injured or being irritated at the very least. So they're two of the positives and the reasons why, and fairly potent reasons why athletes would take them in the first place. So then there's obviously the downside, and I think that this is really what we've kind of got to talk about in a bit of detail. I'm going to base this on a paper that was published last year by Neeland and colleagues in 2024. And they've done a narrative review of 15 studies, and they reviewed how GLP-1 based therapies impact lean body mass during weight loss. What they've found is that, like, the GLP-1 therapies consistently led to a loss of body fat, but consistently led to a reduction in lean mass as well. So as much as people are reducing their weight by 15%, with these drugs, part of that is their subcutaneous
Muscle.
or all their fat, I should say. Part of it kind of like is their muscle mass, skeletal muscle as well. So clearly that has a negative effect on strength, physical function, particularly, and even like metabolic health, particularly in older adults as well.
Yep.
So I think that's hugely concerning.
Yeah, that's a really big concern. We know probably haven't touched. Well, that's probably a good topic for the future. But sarcopenia, we might have sort of touched a little bit on it. But basically, that muscle loss that occurs as we age, and how that muscle loss has a significant impact on a lot of the body functions that we need, and to have optimized for our best quality of life. Yeah, to sacrifice muscle in the search of losing weight, it's certainly a very fine trade-off that we need to consider. So yeah, really important consideration there for those of us working with people that have are using this for weight loss.
Yeah.
But important,
And
powerful stuff, because if we know this, right, we know we can sort of help, and we know we can complement their weight loss drugs with their appropriate training.
Yeah, and I will kind of talk about that in a minute, but it leads me on to just an article that I read just in the ABC here in Australia. They did an article on it a few months ago, and the one I found most interesting, I'll read an excerpt out of this article that was published, and they interviewed a lady in Queensland. I'll just call her Lauren, who's a personal trainer. So she's a Queensland weight loss coach and personal trainer. And the article says that the rise of the GLP-1 drugs has reshaped her business. And she says that clients have often ghosted her after their initial consultations. And later they found out that they admitted to her that they'd been using weight loss drugs and no longer saw a need for her services. So the quote from her was, "I've run into these people a couple of months later and they've lost heaps of weight. And they very shyly says, I've been using a weight loss drug and I'm happy about it." So I think that's the kind of one of the things I think the concern for me is that if a lot of people will view this as just them wanting to lose weight, and if their message is not out there that part of that weight reduction is muscle mass as well, then I think that we're going to wind up with a bunch of new problems across the general population, as well as some great benefits from people losing a significant amount of weight. So
exactly,
I think
right. It's human nature, right? We want to have the fastest result possible with the littlest amount of effort. It is going to be a whole. Yeah, we're in for a lot of trouble and strife over the years. Talking off here before, you said the data from America. Right now currently sits at, what did you say, about 7 million
7
Americans
million.
are current. Yep, and by 2030, when it comes off label, it's going to explode up to what, 24 to 30 million.
35.
Yep.
I think the stats are the 35 million by about 35, and the drug comes off patent in 31. So, it could be more than that because the attention around these drugs is off the chart.
Yeah. And so if we're not having these complementary conversations about, yes, it's great for weight loss, and yes, it can help you shed a few kilos quickly, but hey, we also too see the negative consequences too in reducing your muscle mass, and muscle mass is so important for a lot of joint problems, metabolic health, all these other things. So we need to be having that conversation. So yes, it's a nice and effective way to lose weight, but we've got to top it up with some strength.
And that's it. And this paper, the one that I was talking about, the Neelan one, does go into this, and they do discuss it. And they very strongly recommend incorporating resistance training, adequate protein intake, and even possibly some adjunctive anabolic therapies to help rebuild muscle mass during GLP-1 therapy as well. Wow. So yeah, it's something that, as you and I being physical therapists, physiotherapists, that we need to kind of look at. We need to look at this. That's one of the reasons I wanted to do this podcast, was to kind of alert our professional community as much as the public.
Yeah, well, it's such a hot topic. You go onto any of the social media channels, onto any of the news networks, read a newspaper, online or physical. Ozempic just constantly grabs my news feed and headlines. And to date, I've never had any insight as to the negative effect of the muscle loss. I've just been sort of seeing these news grabbing headlines that all the celebrities and stars are taking it and how significantly they're losing weight. But this is a really important topic to discuss.
The good news is that, and we're again recording this kind of in April, May, 2024. I have found that there's a paper that's going to be 2025. Sorry, there is a paper that's being presented at a conference in a few months from now by Peralta and Reich, and what they have looked at, if they've looked exactly at this question, is if you do supplement GLP-1 therapies with resistance training and high protein, what they've found is that the muscle loss is minimal. So you can negate the effects of it, but you've got to be proactive with it. So I think for the GPs and the people who are prescribing these drugs, when people are going on it, it's like, okay, it needs to be a combination therapy here, rather than just kind of taking the drugs by themselves. So going back to the athletes, if you're an athlete and you're looking to kind of use probably Wegovy in this situation to decrease your body weight, you've really got to make sure that you keep your protein and your resistance training going. And particularly for those who are in endurance sports that may not do it much, you don't want to become too skinny and too weak underlined, because that's going to affect your performance. It's something people need to consider.
Yep, good points.
All right, so we'll move on now to effects on musculoskeletal conditions. So this is people who basically got injuries and concerns. Like, one of the key ones is people with osteoarthritis. For the younger athletes who are listening to this, they won't be concerned about it at this age. But there has been a study done by Blydell, also in the New England Journal of Medicine. This was last year, 2024, Mick.
Yep.
And what they've shown was that people who have got OA, who take a GLP-1 RA, reduce weight, as we know, but also reduce the mechanical load on the joints and reduced pain significantly as well. Right. That's been there, and that was an RCT versus placebo as well. The other thought is also with these GLP-1s is that it may also reduce inflammation. So as we know, with whether it's a sports injury or whether it's OA, clearly body weight and mechanical pressure is an issue, but the inflammatory cascade that you get when the joints get angry as well is something, as physios, we try and kind of get on top of. So these drugs actually kind of may, help along those lines as well. So pretty powerful stuff in people who have got OA as well.
Very interesting. Well, there's always that often quoted percentage that for every kilogram lost, it's 4 kilograms of pressure felt off the knee, and conversely it goes the other way too. So every kilogram of weight you put on, that's an extra 4 kilos that your knee will feel. So that kind of goes hand in hand. But this is like a perfect example of how to sort of cut through that difficult time of losing weight. Like, how many times do we hear people say, look, I've been told to lose weight by my GP or my orthopedic surgeon. My knee's absolutely cactus. I've got end-stage osteoarthritis. I need a knee replacement. They're telling me I need to go and lose 5 or 10 kilos. Every time I go to walk, my knee blows up. It's like, I can't lose weight because, I struggle to do the exercise. So in a certain population, this could be really, really powerful and positive.
And even talking about athletes, I've got a great example of when I was at Hawthorn, and one of the players who will remain nameless, terrific player, on-ball player, so he did a lot of running. But the first couple of years he came into the club, he was quite a solid figure. Like, he was full of muscle. He didn't really have kind of too much fat on him, maybe a little bit. But he just got persistent kind of lower limb niggles. So Achilles, patella tendon, patellofemoral pain, all these things just kept niggling him all year. And as a team, and particularly this came from the strength and conditioning guys, is that in his second pre-season, we said, let's just decrease your weight by 3 to 4 kilos. He was like an 85 kind of kilogram athlete. So he did. He went down to like 81 and 82. All that stuff went. It was just, he was completely injury niggle free for another 2 or 3 years until he started getting older. But I think that for people who have, maybe like me, who are 3 or 4 kilos kind of overweight, reducing your body weight down to help with these niggles can be significant. And that's where these magic pills, basically, will become, I think, even more alluring for people as time ticks on.
Yep. Agree.
Yep. Now, there's one other serious kind of negative associated with the GLP-1s as well, and that is bone health. So the weight loss that's associated may also reduce bone mineral density and increase fracture risk by taking GLP-1s as well. So for people with musculoskeletal conditions, especially those who have got like osteoporosis or have got very degenerative kind of joints with bone cysts and that kind of thing, that they need to very carefully kind of talk to their health practitioner whether they kind of get on these GLP-1s or not, because you've got yin and yang kind of here. You've got the positives of reducing the weight, which we can definitely help with, but if it's also decreasing the strength and the resilience of your bones, then that's not a great situation either.
And it just goes to further strengthen that conversation about weight-bearing exercise or some form of resistance training exercise to complement it. It can't be seen as this miracle cure wonder drug that you just sit back and get your weekly injections and just watch the weight fall off you, because the effect on your lean muscle mass and your bone density. And we think about the population of people who are mostly affected by poor bone density, osteoarthritis. It's going to be that middle-aged and older male and female, particularly females who are post-menopausal, where we see their bone density plummet after menopause. So they're already in a poor bone health state, and then compound that, and often we get through to 50s and 60s, and we often have got some degree of OA changes all throughout our body, some symptomatic, some not, but we're kind of potentially playing with fire here if we're not having this discussion about complementary resistance training.
Yeah, I totally agree with that. But I think that generally, when you do listen to the experts kind of talk about this, and clearly like obesity and excess weight has been a big health issue for many Western countries for a long time now. The pros outweigh the cons with these medications. They seem to be quite safe. There's a number of people who will get kind of gastrointestinal symptoms with them, but if they can kind of put up with it, then reducing their weight overall is very good for the health of the population. But I suppose the executive summary is that if you're going to take them, make sure you continue to look after your muscles and also your bone health. Keep your protein up and make sure you're doing some resistance training as well. It's crucial.
Yep. Good take-home messages there. In your search, did you find anything about mental health? 'Cause I could imagine, if you're losing some kilograms, feeling better about yourself, energy levels improving, was there anything that you found in that space?
Interestingly not. I did listen to one case study. It was actually a journalist over in the UK who went on it, and he had horrendous psychological issues from going on it, that he was talking about ending his life. And
wow.
So this was really quite significant, but when you look at the side effects on the actual medications as well, it doesn't mention anything like this as well. And I think that's because it's such a well-known popular drug, if you do go through the popular media about it, you'll find that there is a number of people who have just got catastrophic stories about it because it's sensational. And then you've conversely got some people who've had some outstanding results as well. But I think that the quality of the information in some of those big studies that have been published in such reputable journals like New England Journal of Medicine shows that they're safe drugs and they should be taken by the right people at the right time in the right circumstances.
Yeah, fair points, and good strong message for us to all to take on board.
All right, mate. Well, as usual, we've just run a little bit over time, but hopefully people enjoyed that conversation. Well, it's only, these drugs have only been around for a few years. So I think even for the physios and the health professionals that are listening to us, read up on this, and it's going to be a quickly evolving area, and it will affect everyone. So, interesting stuff. Anyway, that's a wrap for today's episode of Exercise Matters. If you enjoyed the chat, please be sure to subscribe, leave a review, and share it with your mates. A quick disclaimer, this podcast is for educational purposes only and not medical or individual advice. Always seek guidance from a qualified health professional for your specific needs. Big thanks to our sponsors, Premax, high performance skincare for high performance people, and Learn.physio, world-class education for health professionals. Catch you next time.
See you next week.